believed that around 6 years ago, spinal cord was injured after falling while snowboarding and again 5 years ago while bouldering.
Sin Q MO massage MO a chai KO chai Jonin Kun 10 kilo and coconut amputee sonar auto shadow Kutan 10 kilo Mahitatsu and Mari Kana Shiku no Kud.
So this is an MRI of the neck, and here is the head, and here is the chest. The problem is this bone called the cervical spine. And here, there's a part that sticks out like a beak, and also this black area on the side. There was a prominent hernia sticking out, and also, there's a black area from behind. This is also called a yellow human body, but there are areas coming out. This is an MRI before the surgery, but I think they probably took this. It can be thought of as a situation where it becomes a little white like this, indicating that there is damage to the spinal cord. After that, there may be numbness in the hands and feet, and a decrease in strength. Since 3 years ago, my leg and hand strength have gradually declined. And then, about a year later, I started experiencing hand coordination issues. It's hard to use my hands, like having trouble with movements and finding it tough to hold chopsticks. I've started to see things like that. So, when this person's strength dropped and they experienced numbness, they had surgery, right? This here is the scar from the surgery, and indeed, this narrow area has expanded, widening the passage for the spinal cord. However, the paralysis of the nerves hasn't been relieved, and the numbness hasn't gone away. Once damaged, nerves do not always return or may gradually worsen even after surgery. So, even after the second or third surgery, it was said that it would not heal. Therefore, I was asked about regenerative medicine at our hospital and decided to visit. So even if it's a drip, some stem cells will reach it. However, the number of cells that reach it is clearly small, so in our clinic, we approach directly from the lower back to the sekisui in the lower back and put stem cells into the sekisui. The stem cells that entered the sekisui are filled in the sekisui, which has marrow hair, but it is swirling around because it is cold. PRP is something you take with your own blood and spin it a little in a centrifuge, and if you spin it for 30 to 40 minutes, it becomes ready. However, there are no liver cells in it. Actually, if you want to treat spinal cord injuries, it seems that liver cell therapy using liver cells extracted from fat is more suitable after all. So, I'm going to give you a shot in your lower back, and it's done using the same technique as the commonly performed lumbar anesthesia. And just like that, there may be some bleeding when the needle is inserted, you know? For the average person, it naturally stops or disappears, but for those who have difficulty stopping bleeding. So there's a possibility that it may become so, and there are other infectious diseases that are often seen with injections. There are infectious diseases for any type of injection into the body, but there is also a slight risk for this one, but it is not a significant probability, so it is considered to be safe. On arrival, their left leg was weak, causing a slight body shake and slow walking speed. They also reported difficulty descending stairs without a handrail, in addition to the previously mentioned problem of the high. I had trouble with my hands due to cognitive impairment, so I wanted to address it. Thus, I got an injection in my lower back, specifically in the liver cells, for the first time. After 15 minutes, I measured and found that my left leg was also affected. Initially, I was unable to sit on the floor with a village-like attitude until the conclusion, but presently I am capable of doing so without experiencing any collapse in the middle. I was also slightly taken aback by this, approximately 15 minutes after initially parking. I believe that even if the nerves are partially repaired and linked to the muscles, you can enhance muscle strength by training and rehabilitating them further. Today, I gave the second dose of Kansai butt, and in 1 month, I will give the third dose of Kansai butt. This way, I aim to gain more strength in my left side. I am considering it would be great if I could enhance the strength of my legs. First and foremost, there are a multitude of voices stating that stem cells, as mentioned earlier, are not applicable to health.
But up until now, I have not witnessed any progress in that particular direction whatsoever. Stem cells will evolve more in the future, but in a bio way. There's a baby-like cell called a stem cell, and it's differentiation induction. It may occur soon that a small change will be made prior to administration. Since it doesn't need insurance coverage, it will be a viable choice. However, it is reported to have a very high level of safety and is acknowledged by the government. Since it's beneficial, many people said it didn't work in previous insurance treatments or they couldn't recognize further effects. However, by using Kansai dialect, we can completely get rid of past illnesses. Since there were many who could see a considerable number of families.
So, I was half-type skating at a park in Diffu, right? And I wiped out, man. So I had to soak in a hot bath twice to recover, you know? And then I returned home immediately. The following day, I visited the hospital. During that period, I was in good health. Subsequently, in 2018, which was 18 years later, I tried bouldering. I had 2 falls in November and 1 in December. However, despite falling on the mat with a drone, I was still fine at that time. Eventually, in March, I began to experience a slight strangeness while walking. Gradually, I started losing strength in my legs. So I found it weird and went to the hospital nearby, where they diagnosed me with spondylosis, a little condition. So, I requested surgery, you know. Well, there were risks, so then I thought, well, I'll just take the medicine and it'll wear off. So I took it, but it had no effect. It's not improving, you know. Well, if you ask a friend, what about a total change, like something new or old? Well, I tried both the new and old massage methods, but it had no effect. Well, that's one of my tricks. I got introduced to it by a friend and received a pair of shoes. I received those shoes, but they weren't really impressive. Then, by chance, I heard from another friend that their dad was able to play golf after receiving regenerative treatment for a wheelchair-bound life. By chance, I saw an advertisement for regenerative medicine in the newspaper here. Give them a call right away and make a reservation. I wanted to get a checkup and try out the treatment all at once this year, so I came here to see how it goes. When I did my first regenerative medicine treatment, walking has become so much easier than before, you know. It's like I've become lighter and can do anything now. Sometimes I do muscle training, you know, and my posture has improved. So, I was told that my grip strength was weakening and I was experiencing numbness in the soles of my feet, you know? And the dizziness was really bad. But it's getting a lot better now. When I hold chopsticks to eat rice, they don't move at all. I used to do this to fix it, but it doesn't happen much anymore. When I did it, it became incredibly light, so I can still use it for daily life. There aren't any major problems at the moment, so there are still 3 more times left, including today. I think it will get much better. I'm personally looking forward to it. It got better right away, even on the same day or the day after. This and the pressure have come back quite a bit. I want to return to the original state, and as for me, snowboarding is a hobby, so I want to keep sliding on the snowboard, you know? After treatment, considering a run, but if I push too hard, can't do it, you know. Running, yeah.
Relax, alright? Has your hand movement gotten smoother or something? Sometimes it still feels a bit stiff, but mostly it's not too bad.
What's up with that weirdo who came to remove the creepy void from earlier? No, I'm good. Well, it's working, huh? Allow me to elucidate using the image. This is before the surgery, you know. I had nerves and bones sticking out in various places, you know. It was an incredibly painful and traumatic experience for me. There's a narrow spot here, you know. This is post-op, right? After the fixation, right? There's a small screw here, you know. It's hard to see, but there's a black one here where the screw is tightly inserted. Just around. There are still some white parts left, so I think maybe this is because my nerves are damaged and it will continue to stay like this. So I think I have recovered quite a bit after being shot once this time and once before. I'm looking forward to seeing how this whiteness will change in another 6 months or a year.